Hello, everyone, and welcome. My name is Michael McNutt, Director of Education and Events for WEDI, and welcome to WEDI's virtual spotlight series, Standard Updates with X12. It's my pleasure to introduce to you WEDI's Vice President of Federal Affairs, Robert Tennant.
Thank you, Michael, and let me add my welcome. This is the second in a series of events that we're holding, spotlighting the standards development organizations. Last week we had CAQH Core discussing their new and updated operating rules that they have proposed to the National Committee for Vital and Health Statistics. Today, we are absolutely delighted to have the CEO of X12, Kathy Shepard, talk about the new standards that X12 has developed and that have been proposed to NCVHS. So if you can go to the next slide. So in case you are not fully aware of who WEDI is and where we came from, I'll just spend a couple of minutes. Very interestingly, back in the first Bush administration, Dr. Lewis Sullivan, a practicing physician, knew firsthand the challenges that providers and payers faced exchanging data. So he called in the leading figures in healthcare at the day and said, we've got to come up with a better way, more standardization, move away from manual processes, and charged these individuals with creating what they called a working group for electronic data interchange. And that group back in the early and mid 90s created several reports, which were then turned into legislative language, which made its way into the Health Insurance Portability and Accountability Act, better known as HIPAA. In fact, WEDI was named in HIPAA as an advisor to the HHS secretary, and we performed that role ever since. We have very good relationships with the Centers for Medicare and Medicaid Services, for the Office for Civil Rights, and the Office of the National Coordinator for Health IT. Next slide, please. So how do we do our work? Well, we really focus on one word, and that is consensus. We really try to bring folks together in our work groups and sub-work groups. We have more than 250 member organizations. We track regulations. We provide testimony and develop comment letters. And of course, we have conferences and forums and webinars like the one you're attending today. We also have an opportunity for members to weigh in on pressing issues. And we'll talk about our November 9th meeting in a second, but there are ample opportunities to get involved. And I always like to remind folks that when your organization joins WEDI, every one of your employees becomes a WEDI member. So not just the central point of contact. So if you've got experts in your organization focused on areas that you do not, for example, like privacy and security, we've got a place for them at WEDI. Next slide, please. So really a lot of the work that we do is driven through our work groups, sub-work groups, and our task groups. And you can see here we have a number of groups that meet on a regular basis to discuss challenges facing the industry, come up with solutions, and also develop specific work products to help both the private sector, but also the government be able to make healthcare better, more efficient, and better for patients. And you can see here we have two task groups. The one that we're very focused on now is, of course, the No Surprises Act task group. So if you're interested in these, reach out to Samantha Holvey and get involved. Next slide. So again, when you think about WEDI, you think about one thing. You think about convening. We convene the industry. We bring the various stakeholders together, and we don't just finger point and complain. We try to come up with real world solutions for both the private sector and government. We pride ourselves in our ability to bring together the various stakeholder groups to identify the challenges and, more importantly, come up with solutions. To learn more about WEDI, of course, you can go to our website at wedi.org. And this series that we're involved with now and is culminating with this event today is really leading us to our event on November 9th. We have 4 hours set aside to talk about these two sets of proposals, the X12 standards and the CAQH operating rules. And it's really an opportunity to talk about not just the standards and operating rules, but also talk about some key implementation issues. And it's important for you to attend. It's free for WEDI members. And it's an opportunity, again, to come listen and learn, but more importantly, share your perspectives. We'll have a number of polling questions. And again, this is all done to develop a consensus set of recommendations that we then can provide the National Committee on Vital Health Statistics. They have now scheduled a hearing for January 18 and 19. And so this is an opportunity for us to pull the industry together to talk about these key issues. I will encourage you, we have created a survey for both the X12 and the CAQH core operating rules. So I would encourage you to fill out that survey. It's a little bit lengthy. I apologize in advance, but it's critical that we hear from you, and that helped drive our consensus set of recommendations. And next slide. For this event today, the best way to share your thoughts, your perspectives, but also ask questions is through our chat. We also record the chat, so it's available for us after the event. But take advantage of this. You have the leading expert in the nation on these X12 standards. And so take advantage of that and don't be shy about asking questions. And with that, I am absolutely delighted to turn the program over to Kathy Shepard, who is Executive Director of X12 and is extremely knowledgeable on all these transaction standards. So Kathy, with that, I'll turn it over to you.
Thanks, Rob. I was looking around the room to see who you were talking about when you said that. Can you guys see my screen now?
Not yet.
Not yet.
It's not cooperating with me. It's only
Sure.
because we practiced, Michael. If we didn't practice, it would have cooperated just fine.
Exactly.
Yeah,
Looks like it's getting there. There you go.
All right. I am happy to be here with you guys this morning, and I thank WEDI for the invitation to share some information. I imagine that lots of people have questions, some of which I might be able to answer, but I think if we can get through the slides first, then we can all focus on just back and forth discussion. So let's get going so we don't spend any more time on talking about the time. Of course, as always, what I'm giving you today is my best knowledge at this time. It's not legal advice, and it may change over time. Now, all of our attorneys are satisfied. Let's talk about how we got to where we are. From the beginning, advancing the version of mandated transactions has always been part of the HIPAA plan. It was accommodated from the beginning. I think everyone is clear that computer systems, software, and that kind of functionality needs to be living or else it gets stagnant. So over the years, as the healthcare industry has innovated, and in coming years, as it continues to innovate, the standard EDI innovates and adapts to support those changing business needs. And that's just been a part of the process all along. We publish updated versions of our standard and the associated implementation guides annually now, which people are still getting used to, but it's been happening on the X12 side for about 4 years. And though each of those annual updates supports enhancements that have been brought to X12 as business needs from the X12 implementation base. And many of you may have already seen this information or may already have a clear understanding of X12, but it always seems like there's one or two new people who might not. So just to give you an idea of the scope of X12's reach, we have billions of transactions being transacted daily based on the X12 standards, and that is across many industries, including finance, government, healthcare, insurance, supply chain, and transportation. So there is a huge number of transactions going as we speak today, and the great majority of them will go without human intervention and very successfully in the background. Many of those people using those transactions won't even know they're actually using them because the process is so smooth and efficient that they just think they hit a button and magic occurs, which is just fine with us. The magic is where we offer value. That means that millions of entities around the world have an established infrastructure that supports the X12 transactions. And again, that's across all of the industries that you see above as our main industries, and a few more that have found ways to repurpose our transactions to meet other needs outside of those industries. This is a significant investment from many organizations that result in a stable, efficient, and effective infrastructure that we can build on. The data exchanged in the X12 transactions is well defined and has been used, tested in production for over 40 years. So everybody knows what they're getting, and they know what they're sending back afterwards, and it's a very mature solution that still offers a lot of value. So what we're all really here today to talk about are the HIPAA recommendations. I know everybody is curious about them. And just again, to let everybody know where we stand, we're presenting our recommendations in a phased approach that reduces the impact on covered entities, and it also reduces the impact on the regulators. And this phase approach, as opposed to the suite approach that has been used in the past, comes as a result of literally hundreds of requests, pleas, and suggestions that doing things in smaller batches is much easier for the industry because there are so many people, organizations, agencies, and rules on the healthcare side right now. So we're fine with that. That works for us. Each of the phases that we're putting forward is a group of logically related transactions, sometimes two sets of logically related transactions, depending on how many transactions we have to put forward at a time. Every time we release one of these sets, we will include functional improvement summaries, technical revision summaries, and an implementation cost projection. All of those things are intended to help the implementers, the associations that support implementers, and also, as I said, the regulators who have tasks associated with these recommendations. The timing of the recommendations isn't always able to be very precise, and that's because sometimes we need maintenance to be approved and applied before we're ready to move things forward. Sometimes it depends on the functionality enhancements themselves and how much preparation we need to do to give the industry the tools they need to understand those enhancements, and the availability of the supporting information, which we'll talk a little bit about later on. So we submitted the first set of recommendations to NCVHS in early June, and we copied the other organizations that have responsibilities in the HIPAA legislation itself. And all of the first set are updates to current mandates. So the first set is 3 of our healthcare claim implementation guides, the professional claim, institutional claim, and dental claim, and our healthcare claim payment advice transaction. All of these should be familiar to most of you. And there are no significant changes in any of these. They are all additional functionality or clarifications, wording changes, consistency changes, and things like that. So each of these implementation guides has a corresponding XML schema or XSD that supports the direct representation of the transaction in XML syntaxes. And we produce those XML from the same metadata that we use to produce the implementation guide. So there's no discrepancies between the XSD and the implementation guide itself. So knowing how many of our implementers are using those schemas and XSDs, and in keeping with our position that implementers should be able to exchange consistently defined data using the syntax that meets their needs, we've recommended both the 80/20 EDI standard representation as shown in the implementation guide, the one that everyone is used to, and the XML representation be named as permitted syntaxes. Again, this comes at the request of a great number of people who are using those XML representations, and they want to be able to do so with full confidence that it's permitted under the legislative mandates. So what we proposed is something new. It hasn't been done before, but we're having tremendous support for this approach across the industry. So hopefully we will be able to do as we've proposed, and that is that we want to move forward with the initial evaluations that NCVHS is doing, that each of your organizations are doing, the analysis WEDI's doing as they survey the industry and provide other analysis information to the secretary. We want everybody to start on version 80/20. But once there's a recommendation for adoption and CMS is ready to release the NPRM, the first part of the federal rulemaking process, we are requesting that we move to a later version of that, of the standard that of the implementation guide that's been being reviewed. And why we want to do that is that we will be able to get the latest, greatest, most up-to-date requirements into the NPRM and final rule process, which all of us know are lengthy in and of themselves, but we'll at least have our latest and greatest version at the entry point into the federal process. That will be something different than has happened in the past. And we think it offers a lot of opportunity for us to have a much cleaner cutover with far fewer barriers or costs as we move things forward to a new mandated version. While those recommendations are working their way through the preliminary steps and the federal processes, X12 is working with select licensing partners on developing and executing a pilot test. Many of you who've been around for a while have known that pilot testing has been a hot button request since the early days. It's also been something that's very difficult to put together because we're asking the people who participate in the pilot testing to invest a lot of time and effort and other kinds of resources into doing a pilot that doesn't have a 100% assurance of being moved forward over time. But it's good timing for us as X12 has recently started working far more closely and directly with the vendors, clearinghouses, payers, and other providers that have direct interest in smooth rollouts and clean cutovers. So at this time, we've put a group together and we're working on developing and executing pilot testing that we can report back to over the next months and perhaps years as we get to the full end of all of these recommendations and the various steps that are associated with them. Differently than some, we're going to base our pilots on real world data, and the scenarios being tested are going to come from our real world licensing partners who are doing these activities all day, every day as their main focus. So the pilot testing will also be based on validation criteria so that everybody understands if we say X was successful Y number of times, everybody will understand what is included in X and what that means to their own implementation once they begin to move it forward. The pilot tests will give us a lot of different ways to bring benefit to the industry in what we know can be a painful transition time. First of all, we're going to use the pilot to ensure that data is accurately transmitted between trading partners, and that those tests are going to be very real world. We're not going to say to someone, we're going to send you 3 claims of X, Y, and Z. We're going to exchange transactions as if we were doing live business in the healthcare industry today. And in addition to those trading partner to trading partner transmissions, once all is said and done, we will be able to ensure accurate end-to-end transmission of data across the set of mandated transactions. So we'll be able to send information from enrollment to claim payment to reporting, all down the whole workflow that we all have in our organizations, and show that the data is accurately and successfully flowing through that whole workflow. During this process, we will be identifying improvements that will smooth the implementation. Those of you who were here for the 4010 or 5010 implementations know that there were some costly setbacks during those 2 implementations, but we believe that this pilot is going to be robust enough and based on real data so that we will catch those got yous much sooner in the process, and we'll be able to fix them if we're using the the proposed plan to use the latest version when the NPRM is written. We'll have had an opportunity to smooth out any of those bumps that we identify in the pilot. Likewise, we expect the pilot will identify enhancements that will be useful going forward that we can put into our regular maintenance processes. And that way we'll be able to continue to bring valuable enhancements to the industry in a timely way. In addition, the pilot participants have agreed to track the metrics that they're doing as we go through these pilot efforts. They're going to provide us with level of effort and lapse time information that will be able to put together into some baseline assumptions that other implementers can use as they do their planning and set their resource expectations for an eventual mandate. And of course, at each stage, we will be sharing the pilot test results with the industry. As we like to say, the good, the bad, and the indifferent. We think that there will definitely be successes, and we will be happy to also share the bumps that we ran into and any other intangibles that we don't know we're going to find later, but that we will find as we go through this pilot. So distinctly, what might change based on all of the factors that we've talked about between the 80/20 version that we've moved forward now and the version that we would like to include in the associated NPRM at the appropriate time. The first thing will be housekeeping maintenance, and that's minor changes that we're going to continue to make to improve wording or grammar, to correct misspellings, and to make other kinds of minor changes that don't change the instructions that implementers follow to exchange the data transmissions. There won't be many of you that care that we've identified 4 missing serial commas and put them into the implementation guide, but those changes are important to make over time so that we can continue to be incrementally better with each release of the implementation guide. We also have some internally identified maintenance, some of that related to consistency and some related to other things that the X12 work groups identified themselves along the path. We will have the maintenance that gets identified through the pilots, And we talked about that on the last couple of slides. What we're trying to do to smooth the glide path through the pilot will be reflected in maintenance. We also expect that maintenance will be identified by your organizations, the implementers, the other adopters, the associations that are reviewing. We expect that they will find maintenance items that could be improved or corrected during their internal review processes. And when we're using this methodology that says we start with one and then we end with another, we'll be able to correct, update, enhance, whatever the correct need is as we go, and we won't have to wait for the next mandate to start identifying those. That will, again, put the most current, most needed functionalities into the industry's hands at the most timely approach. In the past, if you haven't been here before, what happened was all of the issues that we identified during an implementation cycle are out of bounds until the next mandate cycle comes around. So we're trying to get as much clean functionality in place between all the trading partners as we can before we lock down with the NPRM. Other changes that if you've been around lately, you shouldn't be surprised to hear are that we are working on crosswalking related fire resources to the X12 instructions and implementation guides that will enable and improve interoperability, in that there will be clear links between the fire resources and the X12 mandated transactions. That will give the industry far greater ability to trust the data no matter what the syntax is, because we will all know which elements cross over to which resources and vice versa as we need to move information in the different syntaxes. We will also be including cross-references to operating rules and other related material that aids implementers across the time period between now and when an NPRM is being finalized, so that we can, again, give the implementers what they need in a single location, keeping their implementation processes as smooth and easy as possible. We also expect that during this period of time, and based on what the findings in all the bullets above, that we may develop additional implementation instructions or aids so that everybody can learn some of the lessons that have come out of the pilots and the other industry reviews. We think this is a huge change that will be very beneficial to the entire industry as we move forward. So what else? That's about where we've been and how we got here. So what's happening now? What's happening next? That will include industry assessment. That's all of your organizations, as looking through the differences between the 5010 version that you've already implemented in your organizations and the 8020 versions that we've put forward as proposed mandates. The difference summaries that show the differences between 5010 and 8020 are available on x12.org now. You can get to them by going to our news and events page and then following the link about the recommendations. What you will find out there is a versatile web page that you can sort and break out in ways that will help you based on some questions and answers, some industry queries, and some unsolicited feedback. We understand that the industry would like to be able to see things in a role-based way. So these different summaries can be filtered so that you can see things that a business analyst will definitely be interested in, and you can see things that programmers are definitely going to be interested in. You can see things that we believe both categories are interested in, or you can see the whole kit and caboodle. And those are 4 separate things. I warn you, the whole kit and caboodle has things in it like added corrected the grammar on something or changed the wording for consistency, things that you might be interested in, but things that don't necessarily change the implementations you have in place today. So don't be too excited if you see 2,000 rows of changes, because once you start filtering into the substantial changes that business analysts or programmers or both need to be interested in, some of those underlying changes go away and you don't have to worry about those. The implementers, vendors, and industry associations that are assessing the 80/20 implementation guides now should be reviewing the functionality enhancements, not to start a fire, not to start a controversy, but for example, we know that there are many people that are very interested in looking at the UDI solutions. Those have been a long-awaited enhancement that has been driven by some congressional activity. People will want to look at those and see how they have played out. Reviewing the substantive revisions, that includes new functionality or new features, and comparing those to your business practices to see if your business needs to do those new functions, how they will impact, how the data coming in will impact your systems. So those are the things that we expect the industry is doing now and will continue to do over the next months, hopefully months and not years. We know that this is happening now because we can see that our individual glass subscriber percentage has been increasing, and most of the people that are purchasing those individual glass seats to get access to the guides are reviewing them as implementers that aren't already X12 members or partners in our licensing programs, which would include commercial use partners that produce products that other people use to solve their business needs, our development use partners, which are organizations that are working on tools that aren't yet in production and available to end users, and our internal use partners who are actively looking at these transactions that have been recommended in set 1 to identify their impact. So the data shows us that people are looking at these guides and they are contacting us with questions as well. So what else is going on? Other materially interested groups are doing assessments. That includes the other organizations named as DISMOs. That includes WEDI. It includes associations, AMA, AHA, CAQH Core, other organizations that want to assist their particular members in some of these steps. And they're doing the same kind of things that the individual organizations are doing. They're reviewing the recommendations. They're consulting with X12 directly if they have questions or if they need something clarified. And then they'll provide their feedback to the NCVHS in that January hearing that Rob was talking about earlier. And maybe they'll provide feedback in other forums as well as we go through this exploration period. In the meantime, we'll be working with WEDI and other material interested groups to host informative sessions, listening sessions, to give sessions like this where people are listening to information and they want a chance to have some questions answered at the same time. Those things will all be methods for getting the information out to the people who might not be as plugged in as those who work directly with the SDOs and the other industry groups. At the same time, NCVHS is reviewing the recommendations. They're considering what they want to see from the industry input and ascertaining the best way that they can get the information they need in order to advise the secretary of their recommendation. We also know that members of Congress are monitoring the progress of these recommendations and asking for updates from the various organizations because they are extremely interested in a few of the functions that are going to be available for monitoring industry activities after these versions move to mandate. What else are we doing right now? We're working on the second set of recommendations, which should be released in September. Oh, I'm sorry, that's not supposed to say September. That's supposed to say November. I knew it was 1 month before or 1 month after this month. I just got the wrong one. I apologize for that. Michael, I'll correct the slides before I send them to you. These are, the second set is also updates to current mandates, and that will include the healthcare claim status request and response implementation guide and the benefit enrollment and maintenance implementation guide, along with the payroll deducted and other group premium payments for insurance products. The second set of recommendations is nearly ready. We are waiting for a few more clarifications from the experts that work within X12, and then we'll be moving these out through the same path as the first set. So we will be sending them to NCVHS, to the other named SDOs and associations, and out to our memberships first. And then the public sharing will start right away. Sorry, the session distracted me by putting a little black bar across the middle of the screen. What can you do and what should you be doing? You should encourage your organization to prepare written comments at the appropriate times and to the appropriate groups. You heard Rob say earlier, WEDI has some surveys out. We believe that other industry organizations also have surveys pending or surveys planned. We think that there will be many opportunities for you to share your feedback and comments, both at the association and industry group level, and then at the NCVHS level when that invitation is open. We would like you to remember that you should send your questions and suggestions about this process directly to X12. That way we are sure that everybody's getting the same information. And yes, everybody, all of us here know a lot about what's going on. The problem is if everybody's asking questions of each other, even if the answers they're getting are correct, X12 doesn't know what those questions are, and we don't have the ability to provide better or more complete information in the rest of the sets as we release them, so that people will have their questions answered from day one and they won't have to be looking for answers as they go through the review processes. If you identify a potential enhancement during your assessment, especially when you're assessing against what your organization needs and wants to do, we encourage you to submit a maintenance request. And you can do that on our website. If you need help with that, you can reach out to info@x12.org and they can provide you with some directions on submitting a maintenance request. And again, depending on what those maintenance requests are, we might be able to turn them around and get them inserted into the NPRM final rule process, which would make them available to your organization much sooner than any other method will permit. You can submit an RFI, which is a request for information, which is the tool that X12 uses to answer questions about what the standards developers and implementation guide authors intended for certain solutions, or how to do something that that you don't see how to do in the implementation guides as you review them. Oh, I'm going to have you submit an MR twice. Again, my apologies. And Michael, I'll send you a corrected deck for that too. Where can you get more information? You can get more information on x12.org at if you go to our news and events page. As I mentioned before, you'll see a link there to our recommendations to NCVHS, which will also provide you with some links on the side of the screen, one of which will take you to the differences output that I mentioned previously. That's probably a good place to start if you don't know where to start. You can also, if you are a licensed user, you can go into GLASS and start reading the details of the implementation guides as soon as you want. All of the named guides are available in the GLASS library, and the differences are available on the through the news and events link, the differences. We will keep our webpage with the differences and our webpage off news and events updated as we go through the various steps of these processes. And if if industry has a need and we see that it will be helpful, we are happy to also post some FAQs up on these web pages so that we can get information out to a wider audience when questions are submitted to us through any of the processes that we talked about before. We're also going to be hosting webinars and other informational or educational forums that highlight the changes to the EDI standard itself and the changes to the related implementation guides for functional enhancements. And we hope that many of you will avail yourselves of those opportunities to learn about the changes between the versions as well. WEDI's going, as I understand it, not to speak for Rob, but WEDI's going to provide more information about their planned listening sessions and other feedback gathering activities besides the survey that they've already announced. We encourage you to reply to those surveys and use those listening sessions to put forward discussion that needs to occur related to the phases and related to the details of the implementation guides themselves. And watch the WEDI pages because they're going to have more activities over time that they aren't ready to announce now. NCVHS will also be providing more information on their plans over time. And so people will want to be watching for all of those places for more information. That, I think, is all I had prepared to talk about today. I'm going to take a quick drink, and then I think we can open up the floor to people who would like to put questions in the chat. Is that what we're going to do, Rob? Questions in the chat?
Yes, and I've got a few to start with, but one came in directly to me, and it's a good one, and that is this person is new to X12, and they're interested in understanding how these changes will have an impact specifically on payer operations. I don't know, Kathy, if you can share your thoughts on that.
Sure. The changes, I have to answer this question in two phases. The changes may have an impact on payers now who are not using the 837 claim transactions for the purposes described under HIPAA, because those people aren't required to rely solely on what is mandated and what is not. As far as what the 80/20 plus or 80/20 and 80/20 plus transactions will bring payer-wise, we don't set payer policies, but we will inform both sides, payers and providers and clearinghouses and vendors and everybody else, what the data exchange content is going to be once these transactions become mandates. So there's not an immediate change to any payers, processes, data collection, or anything else based on these recommendations or the 80/20 versions of the transactions. When we're talking on the mandated side, which is the vast majority of the people who are participating in the healthcare industry at this time. If that's not enough of an answer, send Rob a follow-up question.
No, that's very good. But it does, I think, remind us that not everybody is intimately aware of the X12 process. Kathy, it might be helpful just to sort of walk through the process of how a standard becomes a standard. What's the opportunity for stakeholders to get involved in the actual standards development process?
Oh, that is a great reminder. I'm happy to do that. The first thing that some people, especially people who don't aren't as familiar with X12, to remember is that we have two separate products that we're talking about. And when we're talking under the HIPAA umbrella, we sometimes commingle them. The X12 EDI standard itself is the bedrock of all of the data exchanges across those industries that we went over at the beginning of my slides. So for example, there's purchase order instructions in the standard, and there are shipping instructions for people who want to send things via marine shippers and people who want to send things being rail, and those underlying standards are intended and built to be very broad and support the business needs of many organizations across many industry verticals. So to sit on top of those broad-based EDI standards, we produce implementation guides that are focused on a specific business function, sometimes within one of those industries and sometimes across the industry, especially on, for example, supply chain and transportation. They have implementation guides that cross our subcommittees in order to provide implementers with consistent instructions. Specifically on the healthcare side, we have a set of implementation guides that is already in place, and then we have maintenance requests that come to those. Maintenance requests come in our front door, and they're vetted to make sure they're a legitimate request, not something somebody in our friendly neighborhood Eastern European mafias are sending our way. And also that they're under our purview. For example, if somebody sent in a request that said, we would like the NPRM process to be changed to include oral response functionality, we would not accept that in as a maintenance request to us. We would refer the person back to the federal process owners to put that comment forward. Once we know that something is applicable to us and within our purpose and scope, within our mission, we move it forward to our work groups, and they will have discussions. Many of the changes that are being requested or suggested will go across transactions. So X12N works, instead of working in silo, X12N works in pull together groups, so that for each request, the transaction set experts that are impacted or affected by that request will all come together and discuss it at the same time. This improvement in timely collaboration instead of serial collaboration is what has allowed us to move to an annual process instead of the more infrequent process that we had in the past. The public has the ability to weigh in on that by participating in X12 meetings as non-member participants, by joining X12 and participating, or by monitoring X12 updates to see where we are and what information is available for them to look at. We're in a little bit of a transition now between a process that we used for public comments in the past, which was after all the work was developed and all the changes were made to implementation guides, we asked the industry to weigh in and see, to make sure that they were okay with the concept of the enhancement as well as the technical details of the enhancement. As you might imagine, that system leads to a bit of frustration if our work groups have invested 6 or 8 or 10 months in a solution, and after they've already developed it, they hear back from the industry that it doesn't really meet the industry's need. So what we are moving forward in 2024 is an upfront public comment period, so to speak, which we're calling our feedback cycle. And that's when, before the MRs are worked by the X12 groups, they'll be put out for public comment. And then the comments that get submitted, whether they are, oh, we really agree with this maintenance request, we would use it as well, and we wholeheartedly support it, or whether they're, we don't think this is necessary at all, or this would work to help us if you changed A, B, and C about the request. We'll have all of that information coming in at the front of the funnel instead of the back of the funnel. So those of you who are used to seeing public comment periods when the work is complete will need to get used to seeing public comment periods when the work is initiated. We think that will better serve the industry and also make better use of the volunteer resources that make these changes and implement this functionality.
Excellent.
How was that? Did I cover all the bases there?
Absolutely. We did get a follow-up to the first question on payers. you're asked if possible to elaborate more about the 837s that the payers are not using as prescribed by HIPAA.
I probably can't do that at a very deep level, but in the insurance world, they are using some of our 837 transactions as part of insurance companies communicating with insurance companies, because it's all the information they need to exchange about their covered people and incidents that happen with those people. But they're not submitting healthcare claims for payment anywhere or fitting under it. They're not healthcare claims being exchanged in the way that we talk about them in the other sides of the industry.
Excellent. Eric asks a question: will there be anything in these updates that addresses how payers are sending PLB transactions? And specifically, when a payer puts a lump sum retraction into the PLB, but does not provide any patient account information for when the provider is supposed to apply these retractions.
So let me do the best thing for all of us on this call and tell you I'm not prepared to answer questions today about the segments and elements and instructions at that level. But we do know that people have questions at that level, and we're working on informational sessions where we'll have the experts that develop those implementation guide instructions available to people who have questions at that level of detail. I could answer, and then probably there's 75 to 80% chance I'd get it exactly right, but that wouldn't be good for any of us if I drifted over into the 20% land. You know, kind of like when the marketing people go out and say, oh yeah, our programmers can do that, it'll be done the day after tomorrow. That's not a good thing ever.
Very true. A question: will the 838, the provider EDI enrollment transaction, be added to the X12 list for NCVHS recommendation?
You know what? I'm gonna just make you all dizzy for a second. I think this is the slide that shows what is planned at this moment to move forward as a mandate. We have some additional transaction sets that are nearly ready for prime time, as we say, moving forward to a later version that will allow more consistent functionality between the transactions that we implement. So for today, these are the ones that are on the plan, but as you note, there are other X12 transactions that the industry is waiting and hoping for and will find useful and efficient. So watch for updates from us as we update this list of the rest of what's planned over the next few months. I would say maybe watching particularly in the first quarter of next year. It's likely that there will be some additional transactions added to this list.
Excellent. And while you've got
Rob,
this,
can I say one more thing about that?
of course,
really quick? That what we're talking about here is exactly the value of breaking things up into phases, because we have pieces of work that aren't ready now, but we know the industry wants them. And in this phased approach, we're just going to keep feeding coffee into the grinder, so to speak, as long as we're getting needs that need to be met through these processes. So thanks, Rob. Go ahead.
No, I was just going to reference your last one here. Like many on the call, I'm very interested to see where healthcare claim attachments go. The regulation apparently has gone to OMB for final clearance. So I guess my question is, do you have a sense of where that particular transaction, the 80/20 version, is in the pipeline? Is that looking at early to mid 2023?
So like the rest of you, we're waiting with bated breath for that claim attachment rule. What we're talking about here would be as soon as that rule comes out and gets moved through, we intend to submit a proposal to move it forward to the latest version at the time. So it definitely won't be 80/20 that we move forward healthcare claim attachments. But what we want the world to be clear of is that we acknowledge, and in fact, so does CMS, that we're going backwards when we're talking about going to a 60/20 version when we've moved past that and the other components. So we just want to right away, as soon as that comes out, start another proposal to move a later version forward so that we have a clean set of more recent transactions across the board. This last bullet here is not tied to making any changes to the claim attachment rules that are already in play. As we understand, that would drag everything back to the starting gate. We don't want to do that. We just want to be ready for the next race, so to speak.
Gotcha. That's very helpful. Kathy, you mentioned pilots. When you're going through the piloting process, are you seeking to get a HIPAA exception, or are you not going to be working with live data?
We have not ruled in or out asking for an exception. Probably that will depend on the initial results. What we are going to use for the first for these pilots are de-identified production-ish data. And we have a vendor who's helping us generate de-identified, completely shareable data, but based on real transactions that are really being exchanged, so that there's no question that we are just putting forward transactions to prove the points that we want proven, if you know what I mean. We're going to flush the system with as close to production data as we can, but as you say, de-identified, so that we're not sharing any real people associated with those claims. So the people participating in our pilot, the organizations, have committed to going ahead and investing the resources to put all of this in play without an assurance that it's going to turn into an exception, and expanding the pilot into more of an industry-based pilot. But they would all, I'm sure, be thrilled if that happened. So initially, we're just trying to make sure that we have robust data that adequately exercises the transactions that we've proposed. And once we get past that, we'll decide exactly what the next step should be, likely in concert with listening to the feedback from people who are reviewing the guides and forming their opinions about them.
Excellent. We got two questions that came in. The first, I think that'll probably run us right to our time, but obviously the No Surprises Act includes data exchange components, which may impact X12 transactions. Is X12 looking at the good faith estimation and advanced explanation of benefits process as part of its transactions?
Absolutely. Although I'm not prepared to speak in any detail about it today, X12 and DaVinci have been working together for an extended period of time to put forward a use case level solution that will be integrated between the two syntaxes from the beginning. And we expect to be sharing more information about that over the coming weeks. But we are absolutely working on solutions that support good faith estimates and AEOB at a use case level, and also at a level that should assure the industry that X12 and DaVinci are aligned in making certain that the industry stakeholders can exchange information in the syntaxes they need to but like I said before, with consistent data content and a clear understanding of how the two syntaxes relate together by our data elements, by their resource components.
Last question. I know the attendees here and WEDI members in general are very interested in learning more about the changes between 50-10 and 80-20. How can these folks access the new 80-20 TR3 implementation guides and find information about licensing X12 products?
The licensing information is on our website. You should be able to navigate to it quickly. And if not, you can send a request or a question to licensing@x12.org. So that's the second part. The access to the differences summaries that we've put together is anyone can access those different summaries. They are available by getting on x12.org and clicking on the news and events page. And then on the news and events page itself, you will see an article that says I don't remember the exact title, but it says something like X12 proposes recommendations to NCVHS. Then when you click on that, you will be brought to another screen that describes a little bit more about what we're doing, and it has a link on the side, the right side menu, that's a link to the different summaries. You click on the different summaries, then you click on the implementation guide in this first group that you're most interested in. And then, as I mentioned, you start out with a list of everything, and you can filter things. If you're a business analyst and you only want to think about things that you need to think about, you can filter by business analyst, you can filter by programmer, or you can filter by both of those entities, business analyst and programmer, or you can look at the full gamut of all the times we added a comma or corrected the spelling of a word on the full list. And that's just out there and available to everybody, that summary. The guides themselves are in GLASS, and if your organization has a corporate level GLASS agreement with us, you might be able to, you might already have access. Otherwise, you can work with us to obtain an individual license to GLASS, which is low cost. I think it's $180 a year. Or you can work through your company to have a corporate solution that provides GLASS licenses to a larger number of people.
Excellent. Well, Kathy, let me take this chance to thank you so much for your excellent presentation today. I'll remind folks to build on what we've been discussing today at our November 9th event, where we'll talk about not only the X12 standards, but also the CAQH core operating rules. Please attend, please fill out our surveys. And again, thank you so much, Kathy, and thank you, Tara, for putting that link in the chat. And with that,
thanks for having us.
Oh, our pleasure. And we look forward to seeing you on November 9th. And with that, I will close the event. Have a good afternoon.